Easy ultrasound report. Ultrasound reporting solution. Radiologists will be spending a lot of time dictating the reports while typing. This application is useful reducing the time of typing a report, particularly in pregnancy scans. Because it has all the built-in calculations for fetal age, fetal weight and expected date of delivery. What you need is to enter only the fetal biometry measurements. Rest of all the calculations are done by the application, and that saves a lot of time. And it is the built-in normal Doppler parameters. So it will print the normal Doppler parameters according to fetal age of that patient, and compares the entered parameters are normal or abnormal, and prints suggestions of uterine placental insufficiency and fetal hypoxia if the Doppler parameters are abnormal. This is the startup page of the application. For the new patient you need to enter the patient name, age, sex and LMP. Then select the referral doctor from the drop-down list. For an old patient just select the patient from the old patients list. Then select the examination by clicking the one of these buttons. These are different buttons for different examinations. Early pregnancy scan, 11 to 14 weeks scan, TIFA scan, Doppler examination of pregnancy, and general form for other examinations. And you can see the accounts. You can generate the reports of scan list for selected period and scan list for a selected referral doctor. Let us see the Doppler examination of pregnancy. Select the patient and click Doppler button. It will take you to Doppler examination form. You can enter the invoice number here. Select gestation, single, twins or triplets. Presentation of fetus. Placental position. Fetal heart rate. AFI. Placental grade. Fetal movements, fetal tone and fetal breathing. These are used to calculate biophysical profile. Enter fetal biometry here. BPD. AC. Femur length. Fetal age in weeks and days are automatically calculated, and average gestational age is displayed here. Fetal weight is calculated automatically and displayed here. Expected date by ultrasound and expected date by LMP are displayed here. Doppler values here. Umbilical artery pulsatility index, resistive index, and systolic-diastolic ratio. Middle cerebral artery pulsatility index, resistive index, and systolic-diastolic ratio. Uterine artery pulsatility index. Middle cerebral artery peak systolic velocity. CPR is automatically calculated and displayed here. Fetal age by LMP is 35 weeks. Fetal age by ultrasound is 33 weeks. Reference Doppler values for 35 weeks are displayed here, and remarks displayed as normal. If you want to take fetal biometry age as reference value and check the box here. Now the reference values are displayed for 33 weeks of pregnancy. Different nomograms give different cutoff values as Doppler parameters. If you follow a different nomogram, you can edit these values. You can edit these values in these tables. For example, umbilical artery pulsatility index 95th percentile values are stored here in this table. 35 weeks value of 1.11 is taken from these values here. You can edit these values if you follow different nomogram as cutoff Doppler values. Now let us see the printout. Click on page 1 button. It prints page 1 of the report. If there is difference of more than 2 weeks between age by LMP and age by ultrasound, there is a warning message displayed. You can click No to review if there is any wrong entry. Or you can click Yes to ignore the message. This is the printout. Patient name and details here. The fetal profile. Fetal biometry measurements, age in weeks and days, and expected date of delivery are printed. LMP and fetal age, and expected date. Difference between age by LMP and age by ultrasound examination. Fetal weight is calculated, and normal range is displayed from that particular age of the fetus. For 33 weeks this is normal range. Fetal biometry ratios are calculated with normal range displayed. And visit summary here. The previous visit details are printed here. Biophysical profile is printed here. Now print page 2 of the report. Click on page 2. This is page 2 of the report. Patient details. Doppler parameters and normal cutoff values are printed for that age of pregnancy, with remarks. 35 weeks values are printed here. And the final impression here. Normal Doppler parameters. Now let us see in case of abnormal Doppler values. Let us enter the umbilical artery pulsatility index as 2, and it becomes abnormal. This value is more than 1.11, so remarked as abnormal. And let us enter systolic-diastolic ratio as 4 and it becomes abnormal. And let us enter middle cerebral artery pulsatility index as 1 and it becomes abnormal because it is less than 1.47. And let us enter uterine artery PI1 and it becomes abnormal. Now let us see the printout how it looks. Print on page 2. This is how the printout looks. The Doppler parameters and abnormal remarks are printed. And final interpretation is automatically generated like this. The abnormal parameters suggesting uterine placental insufficiency and fetal hypoxia. It is a twin pregnancy, or triplet pregnancy. Select the examination. You will see additional forms. Enter the values and print. You will get the reports of second and third fetuses. Now let us see the TIFA report. Select the patient on patient's form. Click the TIFA button. It will take you to the TIFA form. Go to gestation. If it is single, select gestation single. Presentation. Now select placental location. Heart rate. Placental grade. Heart movements, and fetal movements. Fetal anatomy. Select C remarks if abnormal. Amniotic fluid. Length of cervix. Uterine artery PI if you want. Then enter BPD, AC and femur length measurements. Now click the button if you want to edit fetal anatomy. Edit the text if there is any abnormality. Then close the form. That's all. Print page 1. The report looks like this. The patient details. Fetal profile. And fetal biometry. BPD, corresponding age in weeks and days, and expected date of delivery. AC, and corresponding age, femur length and corresponding age. LMP and corresponding age. Average weeks and days and expected date of delivery. Difference between age by LMP and age by biometry. Estimated fetal weight and normal range of the fetal weight to that period of gestation. Then the biometry ratios. And summary of previous visits is printed. Uterine artery PI and normal value for that period of gestation. Now close page 1. Go to page 2. Click page 2. Fetal anatomy is printed on page 2. If it is twins or triplets, select gestation here. Then enter fetal profile of fetus B and fetus C. Then print the report of fetus B. And print the report of fetus C. Now let us see early pregnancy reporting. Select patient and click early pregnancy button. This is early pregnancy form. Go to gestation. You see different options here: single, twins, triplets, not visualized, poorly visualized. Select single. Enter GS measurement. Enter CRL measurement. Heart movements, and in heart rate. Remarks template for single sac appears here automatically. You can edit the remarks if needed. Print it by clicking the print button. The printout is here. Patient details. Fetal biometry and fetal age and expected date of delivery. And the impression. If it is twin pregnancy, then select twins option in gestation. SAC2 fields are visible here. Enter gestational sac size here. And CRL here. Fetal heart flicker. And fetal heart rate. And the twin pregnancy template appears here. You can modify if needed. You see the button, Preview Report both sacs. Click the button and you will see the printout. For 11 to 14 weeks scan. After registering the patient details and startup page, click the 11 to 14 weeks scan button. It will take you to your 11 to 14 weeks form. Select gestation from drop-down menu. Single or twins or triplets. Select single. Enter BPD and CRL. Oh, the calculations are done automatically. Edit fetal anatomy if needed. Then print. If it is twins, then select twins option in gestation field. You will see the button to open twins form. The twins entry form opens as a dialog. Enter the details of second fetus in the form. Then close the form. Print by clicking this button. This is the printout. You will see the details of both fetuses. Now let us see general ultrasound examinations. Select the patient and click the General button. It will take you to General form. Patient details are automatically copied here. Now you see different examinations in the drop-down list. Now let us select sonomammography. Template appears here. Edit as required. And print. Printout is like this. There is diagram, and you can mark any abnormality on the hard copy. Now close the report. Go to examination again. Select ultrasound examination of pelvic organs. Print the report. This is the printout. Close the form. Go to examination again. Select ultrasound KUB. If it is female patient, female template appears here. If it is male patient, male template appears here, with description of prostate. Print. This is the printout. Go to ultrasound whole abdomen. Template for female appears here with description of female pelvic organs. If it is male patient, description of prostate appears here. And finally, there is a button hiding here. CT, X-ray and MRI? Yes, you can even do reporting of CT, X-ray and MRI reporting. Click the button and it will take you to CT, X-ray, MRI reports. Select the patient. Click X-ray button. Select examination here. Print. Close. Exit. Click CD reporting. Select examination. Print. That's not all. There are many more features. Thank you for watching.